Hello, my name is Bryan Fonseca, and I'll be discussing the development of nursing in the United States from World War I through the Great Depression. Before the U.S. entered the war in April 1917, U.S. agencies such as the American Red Cross sent military aid and medical supplies to their allies in Europe. When the U.S. began sending troops to fight in the war, there were no official Army hospital units trained and ready to go to Europe. Wounded soldiers were sent to Army-based hospitals run by the Red Cross. Created by the U.S. War Department, the Army Nurse Corps was established in 1901. This department was tasked with training women to care for sick and/or wounded soldiers. Even though this department was created before the war, most people still believe that women were not meant to be in the working class. Due to this stigma, this department did not fully gain support until World War I. Dora E. Thompson was an Army nurse who was promoted to superintendent of the Army Nurse Corps. Under her leadership, the Army Nurse Corps grew from less than 400 to over 20,000 nurses. During her time as superintendent, she battled opposition. Many people believed that women were not suited to work in Army hospitals. She received the Distinguished Service Medal in 1919. The Army Nurse Corps was also involved with American Expeditionary Forces, or AEF, medical specialty teams. These specialty teams were sent onto battlefields to provide surgical treatments to severely wounded soldiers. This was one of the first times that nurses served as anesthetists. Due to the many achievements and advancements in medicine during the war, evidence-based practice was implemented into nursing training schools. One act that was established after the war was the Shepard-Towner Act of 1921. This was one of the first pieces of federal legislation that stated that the government needed to improve health care for women and children. It provided funds to assist with health care costs for special populations and provided tools for public health education. The Frontier Nursing Service was established by Mary Breckinridge in Kentucky. This service provided health care and public health education to rural communities. Mary Breckinridge demonstrated that even if people live in less than adequate conditions, the nursing practice can make a huge impact on the lives of patients. Before the crash of the U.S. stock market in 1929, most families employed private duty nurses in their homes. After Black Tuesday, many nurses lost their jobs since the families they worked for could no longer afford to pay them. One of the many benefits of the Social Security Act of 1935 was the creation of nursing jobs. By establishing Medicare and Medicaid programs, the elderly, women, children, and handicapped citizens gained access to health care and education. This act also provided rehabilitation programs for specialty groups of citizens and emphasized the need for better public health. Lastly, this act created a federal-state unemployment program. The most relevant CUSIN competency related to this time period would be the teamwork and collaboration that took place during World War I. For the first time, nurses were actively engaged as anesthetists in surgery. American Expeditionary Forces medical specialty teams made it possible for nurses to gain specialty qualifications and education on the battlefield that could be used in healthcare settings after the war. BSN Essential Number 7 focuses on clinical prevention and population health. The Shepard-Towner Act and the Frontier Nursing Service put an emphasis on the need for better public health for women and children and provided health care to rural communities. In closing, the United States was highly impacted by World War I and the Great Depression, but through each trial, this country got stronger and learned from the past to make a better future. Thank you.